It's my pleasure to introduce to you Hell's latest arrival, the equal opportunity killer, Alistair!
Hello, it's nice to meet you. Can you tell me where I am? I don't know how I got here, but I think I'm starting to understand. I don't belong among the angels, and maybe that's just fine with me. The things I did up there were high school, but now I'm going for my degree. Hey, sorry, but you just got in my way. I promise, honey, I can feel your pain, and maybe I enjoy it just a little bit. That makes me insane. Haven't been the same since I expired.
Spinal cord injury, also known as SCI, is a serious medical condition resulting from damage to the spinal cord, which is a critical part of the central nervous system responsible for the transmitting message between the brain and the rest of the body. SCI can disrupt motor, sensory, and autonomic function depending on the severity and location of the injury. So, in this case, we received a patient that involved with ASIA-C SCI and present with certain symptoms. So, me and my group will explain more and detail about the case.
So, what is ASIA-C Spinal Cord Injury? The ASIA Impairment Scale or AIS is a standardized method to classify the severity of spinal cord injuries. ASIA-C refers to motor incomplete injury, where there is a score motor function below the level of the injury, but the strength of the muscle affected is graded as less than 3 out of 5 on a standard scale, meaning the person cannot move against gravity. Sensory function may also be impaired, but some sensation is typically preserved. In this case, this injury at the level L2 affect motor and sensory function in areas supplied by the lumbar spinal nerve, impact the lower limb. Let's focus at the patient, Mr. B. He is 24 years old, male, who present with the following issue.
Problem finding, explanation. First, weakness in both legs. Clinical observation. The patient presents with significant weakness in both lower limb, which is common in ASIA-C classification of SCI. This means that there is a partial motor function below the level of injury, but not enough for independent movement. Significance. This affects the patient's ability to perform basic movement, such as standing, walking, or even simple tasks like transferring from one place to another. Weakness in the leg can lead to loss of functional independence and require intervention to promote strengthening, mobility training, and compensatory strategies. Next, reduced sensation in both legs. Clinical observation. The patient has reduced or absent sensation in both legs. This indicates impairment in the sensation pathway of the spinal cord, affecting the ability to feel touch, temperature, pain, or pressure. Significant. The patient may not be aware of injuries or discomfort in the lower extremities, such as pressure sore or other injuries. Sensory loss also increases the risk of fall and loss of proprioception, making it difficult for the patient to maintain balance or recognize their body position in space. Lastly, inability to walk independently without assistance. Clinical observation. The patient is unable to walk independently and need for assistance. This loss of functional mobility is a direct consequence of the combination of motor and sensory impairment due to the SCI and the L2 level. Significant. The inability to walk independently greatly impacts the patient's quality of life. It causes physical, psychological, and emotional challenge, including feeling and dependency, frustration, and possible social isolation. This can also hinder the patient's ability to engage in work, recreational activities, or daily tasks, which further affect their well-being and recovery prospect.
Bridging is a common exercise used in physiotherapy, strength training, and rehabilitation. The exercise focuses on the gluteus muscle, hamstring, and lower back, but also engage the core and hip stabilizers. Aims for bridgings are to improve core strength and stability, enhancing posture and strengthening the muscle that support the spine, rehabilitating after injuries, especially hip or lower back injuries, enhancing balance and coordination, relieving tension and improving flexibility in the lower back and hips, and preventing fall in elderly individuals. Procedure for bridging are starting position: lie on your back with your knees bent and feet flat on the floor. Keep your arms at your side with palm facing down. Make sure your feet are about hip width apart and your knees are in line with your hip. Techniques: press through your heels and slowly lift your hips towards the ceiling, creating a straight line from your shoulder to your knees. Hold for 5 to 10 seconds at the top, then slowly lower your hip back down to the ground. Frequency and repetition for bridging. Frequency: bridging can be done 2 to 3 times a day depending on the patient fitness level and goals. Repetition: for 2 to 3 sets of 5 to 10 repetition. Progression: once the basic bridging exercise become easier, variations such as single leg bridges, elevate bridges, or resistance band bridges can be introduced to further challenge the muscle. Studies shows that strengthening and activation research has demonstrated that bridging activates the gluteus maximus more effectively than some other lower body exercise, making it a key exercise for strengthening the posterior chain. A study published in the Journal of Orthopedic and Sport Physical Therapy found that bridging exercise can be rehabilitate individuals with lower back pain by improving spinal stability and reducing pain.
Knee extend is one exercise used in physiotherapy for strength and rehabilitation. So this exercise more focuses on knee muscles. Muscle that involves is quadricep and hamstring. Next, to improve strength, we need to do a strengthening exercise for knee. For this exercise, the contraindication is we need to avoid any inflammation or recent fracture at knee joint area to proceed the treatment. The procedure is, patient need to in sitting on the chair, therapist need to sit or stand beside the patient for assist. Therapist need to prepare and strap the sandbag with 1 kilogram on the ankle comfortably. Ask patient to straighten the knee and hold for 10 seconds. This exercise modified with 10 holding time, 10 repetition and 2 set for both legs. Because for the neuro patient, we do step by step for early stage and proceed to advanced exercise as long as patient can do. Knee extension exercises are essential for improving quadricep strength, joint stability, and functional mobility in neurorehabilitation. A study by John Stotter, 2023, found that combining traditional strength training with functional movements like sit to stand improves knee extension strength and functional outcomes. Furthermore, low-intensity resistance training has been shown to enhance strength in patients with neurological conditions, as demonstrated by Chang, 2023.
Transcutaneous electrical nerve stimulation, or TENS, can be an effective intervention that can help manage reduced sensation in both legs by stimulating sensory nerve and promoting neuroplasticity. The aim of using TENS is used to enhance sensory awareness, improve nerve signal transmission, and reduce discomforts associated with neuropathic symptoms. However, precaution must be observed, including avoiding its use on areas with impaired skin integrity, over metallic implants, or in patients with pacemaker. Contraindication includes severe sensory deficits, where the patient cannot feel the stimulation as it could lead to burns. To use TENS, clean the skin on the application area, attach electrodes to the areas of reduced sensation, and set the device to high frequency 100 Hz based on patient comfort. Set for 20 minutes. Repeat 1 to 2 times daily depending on the patient tolerance. Regular monitoring ensures safety and effectiveness. The effects of TENS and FES on lower limb spasticity in people with spinal cord injury are examined in the 2017 study comparison of TENS and FES for spasticity in spinal cord injury by Sivaramakrishnan.
For sensation, we use brushing technique and area of application at lower limb area and large areas such as leg, calf, and also feet. Apply firm, long, and even stroke, moving in distal to proximal direction, and avoid circular or back and forth motion. Perform 2 to 3 minutes on each major body area. From this, we can enhance motor coordination and balance, reduce hypersensitivity or defensiveness to touch, improve body awareness, proprioception, and also promote relaxation and reduce anxiety. According to Spicer ST, Matis TA, American Journal of Physical Medicine, 1980, the studies shows that this facilitation effect only lasts for 30 to 45 seconds after fast brushing. In a comparison between icing and fast brushing for muscle facilitation, the latter was found to be more effective and both were most effective during stimulus application.
Strengthening of lower body is an important step to help you move safely and independently. Sit to stand exercise help to strengthen the quadriceps, gluteus, and hamstring. Next, improve balance and stability. Lastly, to boost mobility and independence. Patient in sitting position, therapist standing next patient to support body from fall. Ask patient to hold parallel bar to prevent fall. Keep his neck and back as straight as possible with chest slightly forward. Slowly stand up and ask patient to look in front. Standing for 10 seconds and ask patient to slowly lower his body back down to the chair by bending knees and hip to sit. Do this exercise 10 times 3 sets. Always perform this exercise slowly and mindfully to avoid sudden movement that could increase the risk of injury or falls. If any discomfort, pain, dizziness, or unusual symptom occur during the exercise, it should be stopped immediately. According to Ichi Fujita 2019, she said strengthening lower body is an important step to help you move safely and independently. Sit to stand exercise help to strengthen the quadriceps, gluteus, and hamstring. Next, improve balance and stability. Lastly, to boost mobility and independence.
For the following activity, we will educate the patient about gait training at the parallel bar. The aim of the activity was to improve posture and gait. In this activity, the physiotherapy will observe the balance and weight distribution of the patient on both limbs and will use their hands to provoke imbalance so that they try to recover the proper position. The physiotherapy should be aware of patient's walking pattern and always be aware of patient's condition to avoid them from the risk of fall or stumble during walking. This procedure will be performed by checking the patient's vital sign to make sure they are normal, and then the patient will stand between the parallel bar with both hands holding the parallel bar as a support. The therapist will stand beside the patient with their hand behind the patient to assure the patient's safety, and then the patient will walk back and forth within the range of the parallel bar 5 to 10 repetitions. Study shown by Alexander Derval on 2023 stated that gait training produced significant changes in spinal cord injured patients regardless of the level of injury and sex. The program itself included passive and active joint mobilization, strength and gait and balance training, and re-education of daily activities, aimed to improve physical health and gait independence.
To sum up, spinal cord injury can be classified in ASIA scale. For this patient, he suffered with spinal cord injury at L2 and placed in ASIA-C, which means exhibit preserved motor function below the neurological level, but with more than half of the key muscles scoring less than 3. Injury at L2 region causing muscle weakness, inability to walking independently, and impaired sensory at the lower limb. So, we as a physiotherapist help patients to regain their strength by doing exercise such as bridging and knee extension. Plus, brushing and tense help improve patient sensory. Subsequently, gait can be trained by using a parallel bar to support the patient and prevent from patient to falling. According to Bowden, MG et al. 2007, the use of physical rehabilitation intervention aimed at attenuating neuromuscular impairment as a mean improving not only gait speed but also the strategies utilized by patient to ambulate.
In next patient appointment, suggestion has stated that hydrotherapy can be done for gait training exercise to reduce weight bearing and improve body control. Like it stated from Hamil HV et al. 2018, hydrotherapy aids in reducing people with SCI muscle spasticity and cardiometabolic risk profile, while favorably enhancing underwater gait kinematics and cardiorespiratory capacity.
That's all from us. Thank you for listening to our video. Bye.